right. Good morning, everyone. Welcome to Trak Live. This is your chance to talk with men's reproductive health experts about anything and everything. This is our first time, but we're very excited about it, to have a conversation, spread the word about men's health and fertility, which a lot of people have questions about, but often have difficulty discussing. My name is Greg Sommer. I am the Chief Scientific Officer at Trak Fertility. I'll be bringing in our guest, Dr. Michael Eisenberg at Stanford, in a second. But first wanted to mention why we're doing this and tell you a little bit about who we are. So at Trak, we have developed the world's first product that allows men to measure and track their sperm counts at home. It's called the Trak Male Fertility Testing System. It's available on our website at trakfertility.com. You can also purchase it on Amazon. What you get is a device that allows you to do all the sperm testing in the comfort of your own home. This is a centrifugal microfluidic platform. You get a device that runs on 2 AA batteries and disposable test cartridges. We call these props. The way it works, you put a few drops of a sample in the middle, close the lid, it'll spin, and in a few minutes it'll stop and give you a reading of your sperm concentration, which is measured in millions of cells per milliliter. We can talk about that. We can talk about topics around fertility and sperm health, whatever you want. We encourage you to write in, add comments, any questions that you have. You're also welcome to send us an email at info@trakfertility.com. We'll talk about as much as we can through the course. Let me bring on now our guest today, Dr. Michael Eisenberg. He is the Director of Men's Reproductive Medicine and Surgery at Stanford University Medical Center. Dr. Eisenberg, welcome to Trak Live.
Good to be here. Good morning.
Good morning. Thanks for joining us. And this is our first time coming to the world through the magic of Facebook. We'll be recording it and streaming it on the site later. But this is our first time. And Dr. Eisenberg, you and I have worked together for quite a while now. I'm glad that you and I are doing this together and navigating this brave new world together. Perhaps just take a few minutes and introduce yourself. I think the audience would really like to know a little bit more about your background and your current practice there at Stanford University.
Sure. Well, certainly excited to be here. I think this is a great forum. Excited anytime anybody wants to advertise men's reproductive health, because I think unfortunately it doesn't get as much attention as it deserves. Obviously, it's kind of the focus of what I do. So I'm a urologist, trained to be a urologist, and then I had specialty training in men's reproductive health and infertility. And so that's what I do now. I direct the program here at Stanford. Every year I see thousands of men with reproductive difficulties and help them essentially have children. That's my clinical focus. My research focus is sort of centered around that same topics. And I'm most interested in how a man's, overall health links to their reproductive health and what factors may be interacting there, so that we can hopefully, again, do better by men when they come in to figure out what medicines they're taking, which may not be ideal, lifestyle habits, things like that we can sort of correct and try and improve their fertility as we're seeing them. And, not just their fertility, but obviously their overall health. I think it sort of kind of nicely gels with just the mission of this men's health initiative.
Right. Yeah. And, this is Men's Health Week. We're kicking it off. And June is generally celebrated as Men's Health Month. And the week leading up to Father's Day has generally been recognized as Men's Health Week. And so this is a time to really talk about these topics on a different level. And I think a lot of people tend to not realize maybe how big of a problem male fertility is, or how much of a role men play in the reproductive health process. Could you maybe kick us off just by talking about that a little bit? In your opinion, is this an underappreciated problem?
Yeah, absolutely. I mean, if you look at infertility generally, it's probably about 15% of all couples. So 1 in every 7 couples is going to have difficulty conceiving. And then if you look at those couples, about half of them are going to have some male factor contributing to it. So that's millions of couples in the United States that are afflicted. And I think a lot of times there's just not a lot of knowledge about that's potentially an issue. If you then go on and look at some data collected by the CDC about who actually gets evaluated fertility and kind of learns about problems, probably about a quarter of the time, the male partner is never evaluated. So I think there's a lot of missed opportunity. And I think a lot of it it's just because there's a lack of knowledge. You know, women are used to going to the doctor every year from an early age for pelvic exams and things like that. And that mechanism isn't really in place as much for men, unfortunately. And I think that's just a missed opportunity, you know, not just for reproductive health, but for overall health as well. And I think, you know, along with that, I think there's just a lack of knowledge, not just in sort of the general community, but also, you know, in the medical community as well, that this is, you know, sort of an underserved issue. And also that there's a lot that can be done. You know, there are many factors that we can identify and actually correct to help people sort of achieve reproductive goals. And then also this kind of a sort of a recurring theme of everything that I've said. I think a lot of these do tie in directly to overall health too. And I think there's an opportunity just for men to live healthier lives. You know, there's a reason that men die earlier than women. And I think a lot of those factors may tie in, you know, even early on. You know, men in their 20s, 30s, and 40s during the reproductive years, you know, talking to men about health habits, smoking, things like that, that we can try and improve upon. And this, you know, trying to have a baby, I think, is a powerful motivator for a lot of that as well.
Right, absolutely. I want to talk on those subjects a little bit in a second, but I thought it could be interesting. I don't think a lot of people realize how much training and education actually goes into someone reaching your level as a physician. And, you know, just to piggyback on your point about men's fertility not really getting the attention that maybe women's fertility does, you know, we found that there's only a handful of physicians in this country that specialize in this area like yourself, versus, you know, the overwhelming numbers of physicians looking at more of the female side. So maybe tell the audience about what it took to get to where you are, how much training and education you went through, your stops along the way, maybe what drove you to have an interest in this area, and then talk about the community of men's reproductive health specialists which you're a major leader in.
Yeah, taken me way back, and I think some of it I probably blacked out, but so it takes, you know, obviously it takes a lot of work. I don't think it'll surprise anybody to become a physician. So, you know, you start with undergraduates and then you go to medical school. And in medical school, I actually spent an extra year to do research at the NIH because I did know that I wanted to focus on research. And then after medical school,
to medical school,
I went to medical school at Yale on the Northeast. And then after that, you know, during medical school, you're exposed to many different specialties, and that's usually where you decide what you ultimately want to be when you grow up, so to speak. And I think some of it is somewhat random. You know, you're exposed to many different fields, but not all the fields. You know, there are certain ones that are required. They're kind of core competencies like internal medicine, surgery, pediatrics. Everybody does those. But some of the other fields, like urology, for example, not everybody does, and you have to sort of select it. Medical students have to decide they do want to be exposed to it to see if maybe that's something that they're interested in. So early on, I knew that I wanted to do a procedural field, of which urology is, and so I selected that. And, you know, I think some of it is, you know, somewhat random who you're kind of exposed to and the relationships that you make. And I really like the urologists that I work with. I thought, you know, the problems that we deal with, I think, are very interesting. I think in general, we have a good sense of humor given the part of the body that we're focused on. And so for that reason, it seemed like a good fit for me. So then you apply to residency. Urology tends to be one of the more competitive specialties. So you have to apply really all over the country to dozens and dozens of programs. So with that, then you go around the country. I don't know how much information you want here, but you go around the country, interview all over, find some programs that you know, seem well suited to you, that have all the avenues and different aspects that you like. And then there's sort of a rank list where the programs rank the applicants rank the programs, and then through computer algorithm they select who goes where. So I went to University of California, San Francisco for my residency training, and then, you know, sort of a similar thing. You get trained to be a urologist, but there are obviously, as we kind of talked about, other aspects to it. So some people focus on cancer, some people focus on infertility. So I chose to focus on infertility, so that the process sort of repeats. You look at the different programs around the country. And when I was applying, there were just a handful. There was probably about 4 or 5. And again, it just speaks to how few. I mean, if you imagine every year there's only about 4 or 5 sort of reproductive urology specialists being trained, that's really not enough, given that we talked about there's needs for millions of men to see, you know, people like myself and others in the specialty. But ultimately, I completed the fellowship, found a position here at Stanford, and then basically started the program to help men. To sort of, there was a female infertility program here, and then I built up the male fertility program to work hand in hand with that. You know, there are,
how many years of schooling are we talking about?
Oh man, let's see. I don't want to skip one because they're all so fun and so important. I think it's 12 after undergraduate.
Oh, yeah. So he knows his stuff, people, and this is a great chance for you to learn from one of the top experts in this space. You know, you've been working with our team for a while on Trak, and really a believer in what we're doing with the idea of early testing and tracking of sperm count being important for men's health. Mm-hmm. Tell guys why they should care about their sperm count early on, and the importance of tracking it for a lot of different reasons.
Yeah, well, I think there's a lot that goes into that. And I think, you know, people probably don't realize that, you know, you have a lot of control over your sperm count to some extent. You know, you're probably born how tall you're going to be, and that's sort of predestined. And there's not much that you're going to do necessarily that can change it. But for semen quality, I think that's not true. I think there's a lot you can do that makes it worse, and there's also a lot that you do that makes it better. So I think that, you know, getting knowledge early on where it is, I think may make you, you know, do some things a little bit differently. So hopefully you can be on the higher trajectory rather than the lower one. But another kind of focus of the work that I've been doing, and I'm, you know, fortunate enough to give lectures all over the world on topics related to this, is how a man's fertility may be a window into future health, maybe sort of seen as a biomarker. And so kind of where you are early in life may actually portend later health aspects of this as well. And I think we're really at the infancy of this field. But I think that's potentially another reason, just to kind of understand, you know, where you are. And again, we get knowledge earlier, we can potentially put in play. And just like we talked about women seeing their doctor early on from a young age, for men, they don't have that in place. But again, if we see some warning signs early on, maybe we can start to institute some aspects that can improve things, not just reproductive health again, but looking at overall health as well. That's great.
Yeah, and you mentioned early on about, you know, one of your big emphasis at Stanford is on the research component of it. I want to talk about that in a second. We actually just had a question come in. Someone asked, do I have to use the app? So that's a good question. We can talk about Trak a little bit more. So Trak is the device, as I explained. It's a home testing system. We also have a companion mobile app that it's a free download. It's called Trak Sperm Health and Fertility. And this is a great topic for you, Dr. Eisenberg, because you were heavily involved with designing it and what it does. The answer to the question is no, you don't have to use the app, but it really complements you can use the home testing kit on your own. It doesn't rely on using the app for any interpretation. But what the app does allow you to do is, one, log your results and learn a little bit about what they mean. You can track them over time. But perhaps more importantly, we have a health and lifestyle tool in there that can really be educational for people, especially early on. So the Trak app allows men to answer a series of questions, multiple choice, yes and no. And the point of it is to identify risk factors for infertility. So it's things that are happening in a man's life that could be causing fertility issues, and then some guidance around why that is and what the men can do about it. And we've seen it to be really engaging and really helpful to men. Dr. Eisenberg, perhaps you could comment on the importance of early education and why you think tools like that you helped us build can be empowering and educational, especially when we're talking about men early on who otherwise, till that point in their life, may not have a whole lot of insight into their reproductive health.
Yeah, that's a great question, sort of the value of the app. And I think, you know, the product itself will give you the count, but I think there's just so much more to it than that. You know, obviously, if you're totally normal and in a great range, there may not be much else you have to do. But if you are in, you know, kind of the less than ideal category, then I think there's a lot that can be done. And this really helps you kind of look at your life, take a step back, and just understand aspects to it. I think that, you know, certainly for me, it's stuff that I think about sperm all day long, but other people probably don't. And so kind of being able to understand what affects semen quality, what affects sperm production. And it gives you some insights into things you can do better or worse, sort of centered around that. And I think that's just really valuable. I think education is really valuable. I think, otherwise you're kind of looking at this in some ways just in a bubble. And I think that this puts a lot of things in perspective and context. And I think that's just one of the kind of central values, I guess, of the app.
Right. Oh, well said. And thanks for the question, Dave. So let's get back to the topic of research. You mentioned your ongoing research program in this space. Tell us about the tools that you use as a researcher to look at men's health and fertility status. And then secondly to that, tell us about some of the more important and more interesting findings that you've revealed through those tools.
Yeah, so, fertility is not just generally tracked on a national level, unfortunately. Obviously it's very, very important to me and lots of other people, but it's not something like cancer that's necessarily tracked on a nationwide level. So we have to use sort of other kind of clever analyses to figure out how best to identify people. So one thing that we've used is use some databases of men that have gone in for semen testing. We can do that. Insurance doesn't always cover, but often can cover some testing. So we can use national insurance databases looking at men that put in claims for fertility testing, and then we can use that to be able to see essentially how they do later on. I think one of the exciting potentials of Trak, for example, is that it may allow more people to be tested and kind of lower the barrier, I think, for adding semen, adding sperm counts for research purposes. So, we've been involved in some collaborations, and I know you have with other investigators as well, offering this as a tool, where they're looking at fertility but aren't able to really assess male fertility. Women, you can ask pretty simply about ovulatory cycles and things like that, but for men, there's really no way for them to know what their sperm quality is unless they've had a test before. And, going into a lab is, has some drawbacks, some embarrassment, and some inconvenience, and there can be some costs associated with it. But being able to send this, Trak kit to people's homes, being able to do it from the convenience of their homes, I think has really been a tremendous gain for the research community as well. So I'm, looking forward to some other projects that we have down the road for that as well. And I think that'll really help us understand a little bit about, more how fertility impacts health, because we've looked at many different outcomes. We don't know why. We looked at cancers, for example, showing that men with lower sperm counts may have higher risk of cancers. We looked at other kind of more other serious conditions like diabetes, heart disease. So I think there's a lot there. We really need to understand why, because we don't want to certainly be alarmist about this. But again, I think there is certainly an opportunity for us to do better, because these are outcomes that usually are several years off. And so if we can understand why, hopefully we can mitigate some of that risk. That would be the goal. Yeah.
Well, let's talk about why. I mean, certainly, we want to be data driven and knowledgeable, but do you have hypotheses, inclinations around the physiology here? Like, why would a man with a low sperm count be at higher risk of cancer or diabetes? What causes that?
Yeah. Well, I think there's a lot of possibilities. About 10% of the male genome is devoted to reproduction. And just given that there's only about 24,000 genes in the human body, it makes sense that some genes are involved not just in reproduction, but in other organ systems as well, just for efficiency purposes. So it makes sense that if you can't make sperm, that same gene may also be involved in some other aspects as well. And so that may be one possible etiology. There also could be sort of what's called developmental origins of disease. So, we think that fetal exposures have powerful impacts on the rest of our life. So those same fetal exposures that can cause low sperm counts may lead to other health problems.
By fetal exposures, do you mean what's happening to us before we're born?
Yes, exactly. I never like to blame mom, but there's some data when we're basically inside of our mothers during gestation, that can have profound impacts for the rest of our life. So that's another hypothesis. And I think the other thing that really sort of bears some kind of thinking about is sort of these kind of lifestyle aspects that we've sort of touched on. So it may be that, for example, obesity could be a shared risk factor. So We know that if men are a little bit overweight, they tend to have lower sperm count. So we know that men that are overweight have higher risk of getting diabetes. So it may be that that could be the common etiology that explains it. But again, I think still if the first window that we get into that is sperm count, and that's maybe an incentive for men to do a little bit better to look into their health. I think that still could be very, very important for, for men's health, like we're talking about this week and this month.
Right. Okay, we had another question that come in. Let me show it here. So Ray asks, can you really change your sperm count? Dr. Eisenberg, what say you?
Well, absolutely. I mean, I think the first thing that we do when we come in for an evaluation in my office, obviously complete history and physical examination. And during that history, we're looking for factors that can impact it. So there are, we talked about being overweight, smoking. Those are certainly factors that can impact health, but can also impact semen quality. Other exposures that men have, the testicles are outside the body because they need to be a little cooler. So things that warm them up can negatively impact it. So, laptop exposure is a common one we see here in Silicon Valley. Hot tub saunas, a lot of people like to do that to unwind after work and on the weekends. And it's not good for sperm production. It's certainly been shown, in my practice and in the research community as well, that can impact it. And so those are some simple examples of things that men can do.
So that's interesting. So do you think Silicon Valley has potentially a bigger male infertility problem due to sperm count or laptops and I don't know, working out of coffee shops and things?
Well, maybe. I think laptops are actually becoming, they're kind of falling out of favor a little bit. Now things are getting even smaller and more mobile, but maybe in the past, maybe 10 years ago, it was more of an issue. But yeah, I think things do vary around the country, and that's certainly a possibility of why it may be, some occupational exposures.
Right. So these things all kind of sound like general health. I think people know that being overweight is not good for them. Smoking is bad. Mm-hmm. What are some of the other ones that maybe people don't necessarily think about that are particular to fertility? You mentioned laptops, hot tubs. Are there others that people maybe don't know about?
Well, I think if we kind of stay along this theme of kind of lifestyle and health, one that we see a lot is testosterone. Sort of kind of thought of as a rejuvenating agent, and it can, for the right patient, it can certainly help. But it's actually been tested as a contraceptive. So I think, every month I see a few patients that have come in on testosterone with very low sperm counts, and we do have a frank discussion about the impacts of testosterone on that. Another one that I see, again, in sort of this lifestyle field is finasteride or Propecia. It's a medicine used for hair loss. And initially it was tested and thought to be safe for men of reproductive age on sperm quality. But, a lot of post-marketing data suggests that may not be the whole story. It's you smirking there a little bit.
I got that going for me, yeah.
But there is some data that maybe it's not great for sperm production. So that's another thing that we look at as well. Marijuana use is another one, thought of as generally harmless, but there is some reasonable data now that may not be the case.
So the hair one's interesting. So is there a correlation between hair follicles and sperm cells?
Oh, I think the exact mechanism is not totally worked out, but, the way that finasteride works is through hormonal pathways. And so that's probably what it's doing in the testicle and the epididymis down there. So I think there's some common links, but not necessarily one for one.
So for young guys, maybe just let it go. Worry more about the sperm than.
For most men, it's probably okay, but I think that that's something to think about if we do see a low sperm count and they're on it. It's a discussion we definitely have.
Right. So if there's a couple out there that maybe they're just starting to try, or maybe they're a few months in, 3 months, 6 months. And it's not happening yet, and really trying to start their family. What are some of the key things that you would recommend to them at this point in their fertility journey? Especially when it relates to the man, what should they be thinking about?
Yeah, well, the definition of infertility is trying for a year and not getting pregnant. So I think, not everybody gets pregnant in the first month, not everybody gets pregnant in 6 months. So I think, depending on the age, it's reasonable just to wait another 6 months, to wait till you get to the full year mark before you get too aggressive or too concerned. Because, on averages, a lot of people are going to be able to get pregnant. But again, we talked about that 15% of couples that aren't able to achieve that. But as far as the man, I think information is never a bad thing. You know, obviously when you go to the store, there's lots of products available for women. You go to the App Store, for example, there's lots of ovulation trackers for women, and they can, again, get some insights into their fertility, I think, pretty simply. For men, it's a little harder. You know, again, I think your product lowers that bar a lot, so I think it's, you know, not that difficult to imagine a man, you know, hopefully maybe one day finding it at the drugstore or, you know, ordering it from your website, being able to do that so they can get some other information. But I think, you know, getting a little bit more information on what impacts fertility, they can certainly start with that. Seeing, you know, taking kind of a frank look at themselves and seeing if there's habits or patterns or medicines that they're on that may not be ideal, and then making some corrections. And then obviously talking to your doctor as well. Again, usually we wait for the year, that year cutoff before we get too excited or too aggressive. But I always tell men, you know, it's never too early to understand things. And I think, you know, I've even seen couples that come in before they get married, just during dating, to want to see kind of where they are. And obviously, if there's any kind of condition in the past where you think may put you at higher risk, you know, maybe surgery on your testicle or other treatments that you've had that, you know, your doctor told you may impact fertility later on, I think it's never too early to get evaluated in those circumstances.
So what kind of doctor should a young man see? I mean, we're talking about, you know, age group. Like, I'd say bulk of my friends and family members that are like me don't have a doctor. A lot of guys aren't seeing a doctor regularly. They should, but they simply don't. So is this something that guys, you know, before that 12-month time point, go see a primary care physician? Can they come see someone like you right off the bat? What would you recommend they do?
I think any of those. I think just getting them in, I think, makes a lot of sense. But a primary care doctor is, you know, obviously is not quite as specialized as I am when it comes to male fertility, but they can certainly do some basic workup, and certainly they're very well versed in, you know, overall health. And I think that's a good starting point for any of these discussions.
Right. Sure. I have one last question about your research. So you made a lot of press probably a couple of years ago now with research showing that men with fertility issues are more at risk of mortality, which is kind of a scary word, right? Mortality. And I was hoping maybe you could explain that a little bit better about how do you define mortality, and what was the link that you found between infertility and mortality in men? Yeah,
that did get a lot of press pickup, and I think, you know, I actually got a lot of emails, LinkedIn messages about that paper. So it does sound pretty scary. I mean, I think fortunately for reproductive age men, the chance of death is low. So I think that we have to just sort of keep that in context. Just again, not for me at least, not to become too alarmist. What we found is that we took a group of men that had a semen analysis and then just divided them into men that had low semen quality and normal semen quality, and found that those that had lower semen quality had a higher risk of early mortality compared to those that had normal counts. So why that is, again, we talked about some of the possible hypotheses that could explain it. You know, it's not certain. But, you know, we did find you know, one kind of sort of take-home point for me, and every time I talk about this or sort of explain this, is just to put it in perspective. For this young age population, the elevated risk we saw for men with lower sperm quality was about 2 to 3-fold higher risk. And that's exactly what you get for this age population if they had diabetes and smoking. And we know a lot more about why diabetes and smoking are associated with health problems than we do about why low semen quality is. And I think it's just sort of a call to arms for people like me and the research community, for the NIH, sort of for funding priorities, which they're starting to look at this topic, fortunately, to understand why it is. Because when you see men that come in that ask this question, it's a very relevant question. It's you know, a very fair question. And I think, you know, the advice I give is usually sort of general health advice, which, you know, which should help them overall. But I think, again, we don't know enough about the nature of the relationship to be able to understand what we can do ultimately to make this better, to mitigate this risk.
Yeah, no, it's fascinating. We're going to wrap this up soon. We have actually one more question that came in. The question was, and this is actually something that I'm especially interested in as a former young man and baseball player. How is sperm health impacted when someone experiences testicular trauma?
Well, I guess it depends how bad the trauma is. But usually one of the kind of advantages to the location of the testicle, obviously they're out and exposed a little bit, but they're kind of free moving a little bit as well, so they can kind of roll with the punches, so to speak. So I think in general, all of us that have grown up have gotten, I think I can distinctly remember getting kicked in 5th grade during a fight. All of us have probably had one or two of those. I
think everyone's had at least one or two, right? Like that's just kind of part of growing up becoming a man, I suppose.
Yeah, I don't want to out him on Facebook Live, but I even remember the kid's name, and that's probably years ago. But
if I'm not watching, go for it.
No. But if the testicles don't swell, if there's not a lot of bruising, it's likely that the trauma is not so significant it's going to negatively impact it. So I think for most of us, it's probably going to be okay. But certainly there are some damage. There's a condition called testicular rupture where you can actually pop the testicle. So you can imagine that can be pretty devastating. Unfortunately, that's uncommon. But I think that if you're concerned, if there's swelling, if there's bruising, significant pain that doesn't go away, you should definitely see a doctor, because I think early intervention for that can have better outcomes regarding fertility. But
those sorts of things could have a long-lasting impact potentially. It could rebound, it could be nothing, but there could be damage that might be worth looking at. Yeah,
don't ignore it. Unfortunately, it's a paired structure, so if you lose one, most men will be okay, but it's better to have both. That's how we're born.
That's great. Well, look, thank you so much for joining us. First Trak Live, I'm going to call it a massive success. I don't know about you. Let's recap what we learned. One, male infertility probably doesn't get quite the attention it does. Folks like Dr. Eisenberg are dedicating their careers to looking at men's reproductive health and what does it mean beyond just fertility and pregnancy outcomes. But there seems to be deeper underlying issues around men's health and outcomes and scary things like mortality that are certainly worth investigating and learning more about. And your sperm count can change. It can go up, it can go down for a lot of different reasons. Testicular rupture is a real thing that if you think that there's a chance that you went through it, certainly get that checked out. But the more that we can build awareness, build education around this, help guys understand these issues, check your sperm count, get tracked, see where it's at, see changes over time. These are all very positive for prognosis and outcomes, especially when it comes to fertility. Dr. Eisenberg, what did I miss?
I think you hit the high points.
Great.
Yeah.
Well, I'd encourage anyone else that is watching either live or watching the stream, write in your questions, info@trakfertility.com. We can write you back. We'll answer them at another time. Dr. Eisenberg, I'm sure will be happy to field those questions via email as well. This has been great. We'll have you back. We're going to do another one of these later this week, part of Men's Health Week and the outreach that we're trying to do. But I think there's no shortage of topics here, and I really appreciate you joining us and your time and all of the dedication that you've given, not only to Trak and the progress become, but to this field in general. So thank you so much.
Yeah, my pleasure.
All right, we'll talk soon. Thanks. Bye.